Welcome to On the Beat. I'm excited today to be sitting with Dr. Andy Barlow. He is the author of 3 #1 bestsellers and out right now, The Code Breaker. We've got your book sitting in front of us. Tell us about your newest book.
Well, Karyn, thank you very much for having me today. I've written 3 #1 best-selling books in the last 4 years.
4 years.
And anyway, it's a pretty daunting task, but the funny thing is after I wrote my first one, never going to write another one. After the second one, never going to write another one. So anyway, the third one, who knows? But
and there'll be a fourth.
Yeah, so what happened over the 25 years of being in practice, I discovered that patients actually have like a code in their health problem. And there's times when you actually just want to treat a specific symptom, like if somebody has strep throat, of course you want to go to the doctor, get swabbed, you have a bacteria and you take an antibiotic. And that's great for acute pain or acute health problems. But the problem is in healthcare, physicians take that same mindset of acute care and put it into the chronic world. And the problem is it's not really a 1-to-1 ratio when it comes to the chronicity and chronic health problems. It's a multivariant problem. Like it could be things like mold, it could be things like leaky gut, gluten sensitivity, and blood sugar dysregulation and inflammation. And I talk about all of that in my third book.
Well, let's talk about blood sugar. We hear about blood sugar levels all the time.
Yep.
What do we need to know? What does blood sugar do for us?
Okay, so blood sugar, if you think about it, think of your car. Yesterday I went and filled my car up, and if you look at the octane level, it'll give you 3 different choices, okay? And we know that in America, cars run on a certain octane level. In the human body, it's really no different, okay? Glucose or blood sugar is actually fuel for your body. That's what gives your body the energy that it needs to function.
So we need it.
Yeah, you have to have it. So in that optimal range, the optimal range, just like with your car, well, blood sugar, the optimal range is 85 to 99. Okay, so there's the range that we have. Now, if we get outside of that range, like for example, I'll ask you a question. If we put diesel fuel in your car, what would happen?
It would not work well.
It wouldn't work, yeah. Well, what if we put jet fuel in it?
Right.
It still wouldn't work, okay?
Exactly.
So see, there's that sweet little range right there, that octane that your car has to run in. Too much, not gonna run right, too low. Guess what? The human body is exactly the same way. If it gets outside of that range, like for insulin resistance, so remember the range is 85 to 99, and then once we move outside of that range is insulin resistant, you're pre-diabetic. And that number that people need to know is 100 to 125. Now the sad part about this is most healthcare professionals completely ignore it at that level because it's not a disease process yet. However, research is clear that when you have even insulin resistance, when it's out of range, that can lead to dementia and Alzheimer's because it actually causes protein in your brain to start to clump together like Velcro, which one of the symptoms of that would be focus, attention, and concentration, brain fog, but also in the body that can lead to numbness and tingling in your feet and your hands. If the blood sugar is dysregulated for too long, it can cause kidney failure, and people can even go blind and cause foot or leg amputation because of that.
So a serious issue, and if people want to see you about that or learn more about your books, how do they get in touch with you?
The best way to do that is to contact the number below.
Okay, sounds good. Thank you so much,
you.
Dr. Barlow. And that's today's On the Beat.